name is Veronica Hunter, and I'm going to be discussing nursing and delegation. Let's start off with defining delegation. When we as nurses delegate tasks, we're transferring a specific nursing task to another staff member. As RNs, we must take all accountability for that transference. This means following up on the task and ensuring that it's completed as it should be. So who delegates to whom? The RN may delegate to the LPN or UAP, and the LPN may delegate to the UAP under the circumstances that the delegated task falls within their scope of practice. There are rules to the delegation process that we must adhere to. Only certain tasks fall within the LPN or UAP scope of practice, so we must be mindful of what and to whom we're delegating tasks to. Some tasks the RN may delegate to the LPN are medication administration, dressing changes, tracheostomy care, enforcing of RN-initiated education, suctioning, administration of NG, enteral tube feedings, and urinary catheter insertion. RNs and LPNs may delegate the UAP to perform ADLs, vitals, monitor intake and output, and phlebotomy. But be mindful that phlebotomy does require specific training and certification. LPNs may not administer high-risk medications such as heparin, administer any medication IV push, titrate any medication, perform any initial patient education or assessment, or administer any blood product. UAPs may not perform any patient assessment or education, delegate tasks, or perform any clinical-related tasks such as dressing changes, tube feedings, or medication administration. According to the North Carolina Board of Nursing, RNs or LPNs are not allowed to delegate any UAP to administer medications unless that UAP is a MedTech trained to do so and have received the appropriate training per the North Carolina Board of Nursing. The North Carolina Board of Nursing states that the RN must maintain accountability for all tasks delegated underneath their care. This includes both LPN and UAP delegated tasks. Accountability means following up with any and all delegated tasks and ensuring that staff fully understands the task before being carried out. The RN must provide any necessary training that the LPN and UAP needs in order to successfully do their jobs. Life on the floor can get overwhelming at times, so we must be mindful of the resources that we have. If a task can be delegated, then do so in order to help the shift move more smoothly. Just remember to be mindful of who you're delegating to and what tasks you're delegating. Follow up on those delegated tasks because they are ultimately your responsibility. Follow those rules of delegation and remember that when we all work together as a team, we can accomplish more together. Thank you for listening.